morning coffee, takes a short walk around his neighborhood, and spends his afternoons doing light work around the house. By most measures, he feels healthy for his age. A little stiffness in the mornings, occasional soreness after a long day, nothing he finds unusual. But a few months ago, something new began to happen. Late at night, usually after he had been asleep for a while, a dull, nagging pain would wake him up. It wasn't sharp. It wasn't dramatic. At first, he assumed it was just the way his body was aging. The pain seemed to come and go. Some nights it barely bothered him. Other nights, it made it harder to fall back asleep. During the day, John felt mostly fine. He told himself it couldn't be serious if it only showed up at night. Like many adults over 50, he adjusted his pillows, changed his sleeping position, and carried on with his routine, believing it was just another small inconvenience of getting older. Medical professionals explain that pain that appears or worsens at night can sometimes be linked to changes in how the body responds to rest, reduced movement, or shifts in circulation and inflammation during sleep. Doctors often look at nighttime pain differently than daytime discomfort because the body is not under the same physical stress. In some cases, pain that becomes noticeable at night may indicate that something deeper is irritating nerves, joints, or surrounding tissues. This does not mean something serious is happening, but it is one of the reasons clinicians pay close attention when patients describe pain that regularly interrupts sleep. Experts emphasize that nighttime pain is not a diagnosis. It is a signal. It may indicate that the body is responding to wear and tear, reduced blood flow in certain positions, or ongoing low-level inflammation that becomes more noticeable when distractions are gone. Doctors often consider how long the pain has been present, how often it occurs, and whether it changes over time. Many people ignore this type of symptom for understandable reasons. Aging itself is often blamed. Busy schedules make it easy to postpone medical visits. Some people worry about what a doctor might say, while others feel that the pain is too mild or inconsistent to mention. Because the discomfort may fade by morning, it feels less urgent. Over time, ignoring it becomes part of the routine. However, doctors say there are certain warning signs that deserve attention. Pain that consistently wakes someone from sleep, pain that slowly worsens over weeks or months, discomfort accompanied by stiffness lasting into the morning, or pain that begins to affect daily energy levels are all details physicians take seriously. Medical evaluation is often recommended when sleep disruption becomes frequent or when pain no longer feels predictable. In John's case, the turning point came when he realized his sleep quality had changed. He wasn't exhausted, but he felt less rested. After mentioning the nighttime pain during a routine appointment, his doctor asked careful questions and began looking at the symptom in context. Nothing dramatic happened. What mattered was that the pain was acknowledged early, documented, and monitored appropriately. Doctors stress that paying attention does not mean assuming the worst. It means respecting the body's signals and allowing trained professionals to evaluate them properly. Many nighttime pains turn out to be manageable or related to common age-related changes, but awareness makes a difference. If you are over 50 and notice pain that regularly appears at night, especially if it disrupts your sleep, medical experts encourage listening to your body rather than brushing it aside. Calm awareness, not fear, is the goal. This video is for educational purposes only. Always consult a qualified medical professional.